I want to ask if it's only me who can record, or can anyone else record? Okay. I think it's recording now. Okay. So yeah, I think we're ready to start. Maybe I can start with a short introduction about the CGHI. Then I will give the mic to Mutile, who is our moderator of today's event. So welcome everyone for joining today's event. We are the Coalition for Global Health and Innovation. We are a youth-led organization for young professionals in global health and international development. So our mission is to empower young professionals to transform their innovative ideas into actionable projects. So we are very happy that today so many of you are joining us. Yeah, so please email us and check out our website. We will share the links in the chat later. So let's get connected. So for now, I'll pass the mic to Mutile.
Thank you, Charlie, for introducing the coalition. Hello, everyone. Welcome to our event. This is the Global Health Policy Development event, and it is the first event of our just launched Young Professional Series. So we're very glad that you could make it. So basically, the idea of and the purpose of this series is to empower, educate, transfer knowledge to young early career professionals, students, people who just want to find connections between the work they're doing and global health. So those are some of the things that we're going to address today. And I hope it will be a really insightful session. So as Charlie just mentioned, my name is Mutile Mongo. I work or support community engagement at CGHI and our internal projects as well. So before we get into the discussion, I would just like to run us through the program. So basically, we've had an introduction from Charlie, and then we're going to hear from Cale, our guest speaker. He has a presentation about global health policy development, and then we'll have a question and answer session at the end. And as Charlie mentioned, this will be recorded and likely posted on our YouTube channel. And since we have a question and answer session, please feel free to write any questions you have in the chat box. Okay. So to introduce our guest speaker, we have someone who is experienced in medicine and global health. He is the Senior Policy Manager at the European Public Health Alliance. He is a global health enthusiast who is interested in health promotion, air pollution, environmental health. And he was also one of the community team leads here at CGHI and one of the team members who pioneered our Action Tank program. So everyone, welcome to Cale Lawlor. Over to you, Cale.
Thank you, Mutile. That's a very warm welcome. Nice to be here. Always good fun to speak and broadcast. So yeah, my name is Cale. I've been with CGHI since the start of 2021, where I started being then just the lead of the community building team. And then I was co-lead with Mutile, and then I kind of, and Giovanna, and then I kind of faded away into the background. But as Mutile said, currently I work as a senior policy manager working in global public health in the European Public Health Alliance. So the European Public Health Alliance is a public health-based non-government organization in Brussels, in Belgium, and basically it collects the ideas and opinions and innovations of a whole heap of public health organizations in Europe and lobbies towards the European Union policy making. So as I said, I'm working in the global public health cluster within my job. So the work that I do is towards EU policy that concerns health threats that are not restricted to one country or one area, really. So for me, that includes things like climate change, air pollution, noise pollution, antimicrobial resistance, but also works with the global health strategy that the EU has and global health in general. So the EU should have more global health sort of initiatives. It doesn't have a whole lot, but I guess the work scope that I cover is all global health, so it's quite nice. In terms of global health within this job at the moment and the global health strategy that the European Union has, my organization worked to initially advise on the global health strategy that the European Union was putting together. And then when it was released in a draft, we also then consulted, like did a consultation on that to suggest improvements or suggest different parts that we agreed or disagreed with. And now that it's been released in pretty much finalized form, we've also now done some analysis on that, on what we think of the global health policy. So that's kind of how my current job interacts with global health. Obviously, I'm also part of CGHI. So as Charlie and Tilly very nicely introduced, that kind of works in a very nice, fun, voluntary way to allow people who have ideas and interest in global health to kind of find a community to be able to share their ideas, be able to be part of a conversation, to be able to network and find avenues for their interests. So that's kind of my current job and my current working or more recent working with CGHI. My career to date, I've been working for, I think, 9 years now, which went very fast, at least professionally. I started my career in Australia, where, as I said, I was a doctor there. So I did my initial training in medicine and quickly kind of found out that maybe hospital medicine wasn't the best thing for me. So I worked in a hospital for quite a long time, but I also did training in public health and international public health, which the degree was called International Public Health, but for all intents and purposes, basically means global health. And I just so much enjoyed that after I finished my degree, I looked for ways to be involved more in global health. I was still working, not full time, but I was still working as a doctor. So on the side, I was kind of doing volunteering in global health. I went to a refugee camp in Greece initially, and then after that, I worked with a drug user harm minimization NGO in Tbilisi in Georgia. And I had some pretty long-standing associations with that one, and was working there on the ground for a little while, and then helping with research, and that continued for quite a long time actually, in a voluntary capacity. And then in 2019, I moved to Ireland. I got a job there as in like public health policy research. And I was doing that until the pandemic started, and then I started working as a medical officer in public health in the National Health Service of Ireland. And I was there until my more recent switch to Brussels. So I went from Dublin to Brussels. Yeah, and that's kind of where I got to where I am. Though I think something this is kind of feeling in global health, or at least I've heard there's a feeling from people that global health, or more so maybe like the World Health Organization, is an organization made for doctors and medical people. But I just wanted to emphasize and really stress that it isn't. And I think that global health work is and policy work is more just a job for anyone who's interested. And so in my workplace, I am the only person with a medical background, and my organization is a public health or an international public health organization. So my other colleagues, for example, would be lawyers, would be people with an anthropology background, would be people with a communications background, European studies background, policy background. So it's by no means a career choice or path that's reserved for healthcare people or medical people. And I think, as we all probably know ourselves, that diversity is the best thing you can have in any sort of organization or field. So yeah, it's a job for everyone, and especially including things like the World Health Organization. So just to dispel any myths that anyone might have about that, because I think the minority of people in the World Health Organization are health related. So, and then in terms of kind of how I got to where I am and how others could kind of follow their global health path. I think what has really benefited me was to, I'm not saying everyone should take unpaid work, but I think for me, I did benefit from those voluntary opportunities that were the working in Greece and the working in Georgia, and then also very much the working with CGHI. I think it kind of gives you such a broad overview of something you're very interested in. If, assuming you're interested in global health, you probably wouldn't be here otherwise. So if you have an interest in global health, that can be kind of an avenue, and it served me very well. When I was doing my interview for my current job, I did talk about CGHI, and I think that really proved, because my job, the title was Global Public Health, like Senior Policy Manager in Global Public Health. They wanted to know I was dedicated to global public health, and I could show I was dedicated to global public health because I'd been volunteering in it on my own initiative for a long time. So I think that, not necessarily volunteering, but, this kind of experience-based work is incredibly helpful, whether it's paid, whether it's unpaid, whether it's, collaborative, whether it's in your home, in another place, whatever. I think it's all just very helpful. I think as well, it might not work for everyone, but I think it's good to kind of be able to focus on what you want and what you like in a career, because the field I came from, which is medicine, is it can be quite restrictive to as to where you go. When you doing medical school, for example, public health or global health was never to me mentioned as an option, really, for where my career would go. It would all be focused around becoming a GP, becoming an internal medicine person, and becoming a surgeon or something like that. And then when I went on to start working as a doctor, again, everyone would just kind of say, this is how you get on this training scheme, this is how you do this, and this is how you lock yourself into a career that you won't be able to get out of, essentially. And that works great for some people. If that's you, great, all power to you. But it wasn't for me, and I think that my experience so far has been very rich, and I'm very much in a job now I very much enjoy and see good prospects for myself for the future, because I didn't want to really subscribe to the kind of pathway that didn't fit for me. And I think that maybe global health is a sort of career space that maybe well, it needs more people, firstly, but also it doesn't, I feel like it was never advertised as an option, really. And maybe that's the case for a lot of other people too. It's kind of this ethereal sort of cloud nebula of space out there that's, seems hard to break into, and it seems far removed from at least the reality that I came from. So I think realizing that that's something you're so interested in, and for me, knowing that my interests and my skills that I had eventually developed and my experiences all led to me wanting to do global health. And that, I think having that is, and eventually getting towards that was just such a good experience, and also very helpful in helping me know that when I to know what to aim for, and then to know that when I kind of got into a position that was along those lines, to know that I had kind of been able to work towards that, and to know that I had, I don't want to say achieved, but because I'm still a work in progress very much, but to know that I pushed myself in the right direction, I guess. And I think that that's very important, because I think that without a big push or pull for people to come into global health, it can be very easy and distracting to take other paths that might not necessarily align with your values as a person or as a professional. So I think if you have the opportunity and the enthusiasm to chase it, while it can be quite demanding and fairly on a very long time scale, I think it is worth the kind of mental investment and the time investment. Like my I did my degree in public health. I started it in the start of 2015, and I did my first public health related volunteering in 2017, and I got my job in global public health at the end of 2022. So that was nearly 8 years after I started my public health degree, and nearly, I think, if I got the addition right, 6 years since about 6 years, or 5.5 or so, since I did my first volunteering. So it can be a bit of a slow burn, but I think, global health is one of those careers that is very experience based, because, you can have a degree and that'll help. That obviously helps an incredible amount. But also having experience in whatever field eventually can help shift you into global health. And I guess that's a point I want to make about against a certain health background or something. You can have experience in a national policy setting or something like that, and that is very relevant experience. Or you can have experience in law, or in planning, all sorts of things. I work with a very diverse set of colleagues who have gotten into international public health because of their interest and their motivation, but also the experiences they've had. Not to say those are the only ways in, but I think that for people who want to move into global health and into global public health policy, that all these experiences you can get, and all this enthusiasm you can have, and all this motivation that you can show people that you have, does a lot of the work for you. Eventually you'll build up contacts, and eventually you'll get more experience in more places, and know a bit more, and bring technical knowledge, and then you're very well placed to then go into a global health space that you really enjoy. So I think the skills that you have and have learned are relevant in global health pretty much no matter what. But I think in terms of forming a career in global health or policy, or global public health policy, or anything like that, I think that the motivation that you show and your dedication are just really, really important things, and to kind of keep sight of those goals, to stay true to what you feel is your path and your interest, and where your enthusiasm lies. And I think that helps contribute to a really kind of rich experience. And there's no one way to get into global public health and policy. There is many, many different ways. Yeah, I think that's the main part of what I wanted to say initially, at least. Have I missed anything?
No, I think you've given us a really good idea of where you started from, how you got to where you are, what kind of experiences you've had that have led to your career. Before I open up for questions, and thank you for that presentation, just kind of following up from what you've been talking about, is there anything that you think you have carried from your medicine degree and has helped you in global public health?
Yeah, for sure. So the role I have now is sometimes, and only very minimally, somewhat technical. So it does rely sometimes a little bit, rely on me having some scientific knowledge and some knowledge of human health. And I can use that in meetings or when I'm advocating or lobbying to say that, you know, air pollution breathed in causes inflammation in this way. But I could do the job without that as well. What I think has been most relevant actually is working in a hospital and seeing working into health in general, and seeing the differences that, you know, social determinants of health and those sorts of things make to people's lives, and the effect of health equity and health inequity and inequality. Because, you know, you can be in a hospital and see someone who's very well off, who, you know, had every chance in life and a good education and was born into money and, you know, grew up in a place where they weren't discriminated, and you can see them in perfect health. And then you can see someone who's had quite the opposite and be in very poor health. And I think to see those health inequities so clearly in person does help to kind of guide how you think about the world and how you think about health. So I think that was very useful for me, because I was, you know, that was something striking to me and that I was receptive to that. I think also that, to be honest, working in medicine and working in a hospital did drive me to public health, because I think when I worked in a hospital, sorry, I'll stop saying hospital. When I worked in health, it was very easy to see how much, or basically the inefficiencies in that sort of medicine, like in treatment medicine. And not because it's in effect, not because medicine is bad, but because you're treating something at the end point instead of having prevented it so far before. We were actually having a meeting today at work, and one of our colleagues said that in their region, there's been a recent report in their region in the UK that the things that contribute to good health in their region are just 20% healthcare. Like only, how do I explain it? Only 20% of their good health relied on good healthcare. 40% relied on the social determinants of health. 30% relied on what was it? Healthy behaviors, and 10% relied on environmental exposures in the built environment. So only 20% of good health in their region was because of healthcare. So I think seeing those things and seeing, you know, because some of my experiences that I did during medical school, you know, I would be in a hospital in Australia, you know, very wealthy country that is treating, you know, normally very elderly people in a environment where there's very robust and stringent public health measures in place. But then I did my placements in Nepal and in Mongolia, and then you see a completely different picture when you don't have public health systems necessarily that are strong or robust, and people are, you know, aren't protected by the government. And when you have things like that so confronting in your face, it really makes you committed. If you know, that sort of person, it really makes you committed to go, well, something could have happened before to have prevented this completely. And so, you know, working in a hospital to see these kind of treatment of the end point of this kind of cycle of things that had happened makes you very aware that you can work somewhere, have much more impact in preventing those string of events from happening than trying to treat the end result of it.
Oh, that's very insightful. You mentioned social determinants of health. Would you mind explaining what those are for anyone who might not be familiar?
Sure. of course, of course. So the social determinants of health are a broad set of conditions which people live under, which they have no control over, but greatly impact their health. So it's starting to branch off into quite a lot of different kind of streams of determinants of health, but the general social determinants of health are seen as things like housing, education, access to safety, access to mobility, employment conditions, access to finances, and things like that. So, you know, if someone lives in a giant house in the countryside and has all, you know, clean water and, you know, reliable electricity, they're probably going to have a positive health impact from that. But if someone lives in a small apartment that's not ventilated, that doesn't have running water or electricity, in somewhere that's dark and loud and polluted, they're going to have a lot more health impact from that. And that's the social determinant of health related to kind of housing, and also many other things. And these all very much overlap with, you know, kind of environmental exposures and healthcare outcomes and diseases as well. So not only do they kind of contribute, they also kind of affect, modify. So as said, I work with air pollution. You know, air pollution affecting a person who is not marginalized at all will have an effect. Air pollution affecting someone who's been marginalized through the social determinants of health, it's much more likely to have a very significant effect on them. And that person's much more likely to not be able to have the means to be able to remedy that themselves. So through no fault of this person themselves, they are in a condition which is bad for their health or has more impact on their health. Currently in the kind of global health space, there are starting to be more determinants of health. So there's starting to be the commercial determinants of health, which is how, you know, things like macroeconomy and trade policy impact individual health and population health. But also a recent one that I found very interesting was the indigenous determinants of health. So looking at how the health effects of, you know, dispossession of land, breaking of intergenerational ties, and the effects of climate change on changing environments that, you know, Indigenous people are used to and rely on. You know, those sorts of things also have quite a significant health effect. And I guess with all of this and in the global health dialogue at the moment, mental health is such a big topic. So, you know, when you look at so many dispossessed Indigenous groups around the world, and, you know, if you're a policymaker trying to do something about mental health of Indigenous populations, you can maybe look at the Indigenous determinants of health and say, well, you know, these people have been discriminated and dispossessed of their land. Maybe that's part of, you know, why we're seeing such outcomes.
Very nice. Before, once again, we go over to the question and answer session, Charlie and Yelena, you have some experience in global health. Is there anything you'd like to add? Something to chip in? Sorry to put you on the spot.
No, it's fine. Charlie, would you like to go first, or can I go? Okay, I'll go first. Well, first of all, thank you, Cale, for such a lovely presentation. It's always great to listen to you talk, but I found this session very, very interesting, especially since I am joining from the viewpoint of a student. So I'm someone who has yet to enter, you know, and choose my career. So I think it was very helpful to just kind of hear about your journey in global health. But maybe from my point, I would also like to agree that even voluntary work is always a great start, because for me, I have never had, so I'm from Serbia, and I personally never had many opportunities to find out and learn about global health. So I found that joining CGHI also presented a great opportunity to learn about global health, like from work and very directly. So I definitely agree with you that even maybe doing some unpaid work or learning from your colleagues around the world, it really makes a difference, especially in kind of figuring out where you see yourself or what you want to do one day. So I definitely agree with that, I would maybe just like to ask a question, but this could totally be put into the Q&A session later. What would you say are maybe some of the key skills that helped you figure out your way or get into the career that you're pursuing now?
Key skills. Well, I think that through my work and through my initial work, and maybe just from a disposition, I always like talking to people and communicating with people. So I think that does help in my work a lot, and it probably helped me, technically during the interview that I did for my work, but also, in forming alliances, in having experiences, in getting to where I am. So I think, I think communication skills were a big part of it. I think that particularly for global health work, it's a good skill to kind of have a broad scope of how you think about health, because where I came from had a very narrow scope. If I was once upon a time doing rotations in a hospital with one particular team who don't care about anything besides the ankle bone, and when you kind of zoom out from that, there's a lot more things that are happening in the world. So I think, people who are attracted to global health probably have a bit of that in them, that they would like a bit of a wider view of things. But I think maintaining that skill is important, and it will serve very well because, kind of with the examples I was using before for the social determinants of health, someone's individual health situation, which is, kind of what we all care about in global health. Someone's individual health situation is often not just as clear cut as what it is. It's all these systems that are happening outside of them in this very complex world that they live in. So I think keeping that sort of overview is really quite important. And I don't know if it's a skill, but I'll just say it is just enthusiasm, I think, as well, because the enthusiasm is the driver that makes all these things happen. And the enthusiasm is what keeps you going. And the enthusiasm is the thing that you can try and prove when you're going for global health, whether it be advocating, or whether it be volunteering, or whether it be doing job interviews, or setting up your own global health firm, or whatever projects. The enthusiasm is a skill. Like, I think there's some skill in it. It's probably a disposition more, but there is some skill in being enthusiastic and self-driven and motivated.
Perfect. Thank you.
Thank you.
So thank you, Cale, for your very, very insightful and I find it very sincere sharing of your, your educational experience, your work experience, and your insights. I really, really enjoyed it, and I really appreciate you taking your time to, share your stories with us. And that's why we want to have this kind of event. For myself, also personally, I feel like I learned so much from everyone around me to hear about why they chose what they do now and their journey, because we might have done different things, studied different things, and worked at different jobs. And like if we meet at CGHI, there's some shared passion here, and that's very interesting for me. And especially, I think you shared so many interesting points in your presentation. For example, you said when you were working in health in the front line, you are wondering like what are more like policy-based approach to solve global health issues, and that's very interesting. I think obviously everyone in global health has different expertise and different tasks also they're good at. I think it's very interesting that you also said like you love interacting with people, and also I think you've proven in your work in CGHI and your interactions with us, we find you like you are very curious to learn how marginalized groups have different access to health, and like how certain policies affect different groups differently. I think that's very essential in global health. I think for anyone who work in global health, it's very important to understand like like you said, the social, economical determinants of health. So yeah, I think these are very interesting points. And I wonder, maybe like I was suggesting in the chat, but sometimes the chat doesn't really appear. I was inviting everyone to introduce themselves in the chat, or feel free to unmute yourself to tell us about yourself and yeah, ask questions directly to Cale or to CGHI. So my background is political science, and why I got into global health is because I am extremely passionate about women's health and also health equity, and I find global health is really encompassing, and especially being in the CGHI, I learned so much from everyone from different continent. So I think there's so much value in volunteering work and joining organizations, even online, doing things remotely, just connect with people and to learn different stories and different insight. So I also encourage everyone to connect with us on our website and our social links. So yeah, that's it from my side for now. Maybe I give back the mic to Mathilde. Thank you.
Thank you.
Thank you both to Yelena and Charlie. So we do have a few questions. We're going to transition into our question and answer session. And the first question comes from Nuri Alp. They say, hello, my name is Alp. I'm a medical doctor and I'm doing my residency in public health. It's not a typical residency program in many countries. And I want to ask Cale, is public health residency known internationally, or would I need a master's degree for a career in global health?
Sure, thanks for that. To my knowledge, I don't think you would need a degree in global health, and medical residency in public health is very, like, it's plenty, to be honest. I think that it is known internationally. I've known a fair few people who have done a public health residency, and I think just even, having public health on your CV is quite an endorsement in itself if you wanted to go into public health. As like many of the I work in global public health in EPHA, but I'm one of the only ones who would also have a degree in public health. A lot of my colleagues don't have a degree in public health, and they come from purely policy backgrounds. And that would also go for, things like the World Health Organization or other international organizations. When I look at World Health Organization ads, job ads, they normally don't state specifically that you have to have a master's in global health. They often would say something like maybe they would say something like a degree in a relevant field, and then they list a whole lot of degrees, which are pretty much everything. But then sometimes they also say, or a bachelor's in this much experience, or sometimes other diplomas in this much experience, or sometimes just experience. So I think that I think public health residency is known, and I don't think you need a master's, a specific master's in global health, or a master's necessarily at all.
Okay, thank you. Our second question is from Marina Smith. Can you speak more on the policy development aspect of your role? You mentioned lobbying earlier. What would that typical process look like for you?
Sure. So I can use an example of what I would work in and what my colleague who I work closely would work in. So there's a few different parts of it. Part of it would be, translating research and keeping an eye on research that's coming out in public health. And if there's something emerging as a big risk, you can start advocating around that. So, for example, it's the evidence is emerging that maybe cooking with gas in your house is not the most healthy thing. So what my colleagues and I have then been advocating for in that is, when the next revision of the EU law that looks at cooking appliances, when that comes up, we've been advocating to say, okay, maybe when you do the next assessment, when you do the next policy revision, you should include an impact assessment on health and have the public health implications of different cooking methods included into what will eventually be the policy. And then by doing that, you can help identify the entry points for health into that debate, and also highlight health risks, let's say, or health implications that wouldn't have been there otherwise. So there's part of which is kind of bringing in research and creating a new space for efforts to make healthier spaces. A lot of what I would do is on responding to policies that are being revised. So currently in Europe, there's a very long process going on, which is looking at the air pollution policy that covers all of the EU. So that is something that's been happening for a long time. And when I started my job, it was already very developed. But what I would be doing, day to day or things like that. So what initially happened was that my organization works in a kind of consortium with other similar organizations that work to advocate for the EU to be ambitious and to keep health in mind. And our job really is to keep saying to them, keep health in mind, keep health in mind, keep health in mind, because they won't necessarily, politicians who make policy are politicians and they're bureaucrats and they're public administrators. They don't necessarily care about health. So, the job of people like us with the motivation, the know-how and the skills is to keep saying, this is the health risk, you need to consider it. This many people are at risk. This is what you can stand to invest in a public health system. This is what your policies will do. So part of what I do in that job is to coordinate with this consortium of people and to meet with individual policymakers, to have meetings where we talk to them and say, these are the things we're concerned about, and this is what we think you should do from a health point of view, and to bring evidence to them to say, this is why we think. So because, for this specific policy, the EU did an impact assessment that said, the EU, this much is how much is the cost from air pollution every year, and this is how much could be saved in healthcare costs. And we also bring in extra research, we bring in other things, we bring in opinions, and we bring in, our position of all of our public health organizations, and we say, you should go for the maximum health-based ambition when you're making this policy. And we're up against people like industry and, countries that don't want to cooperate or don't have these health kind of things in mind. So, when a lot of the debates that we would be in are, against the car industry, for example, or the coal industry, and they're also inputting into the same debates. And if there isn't a health voice, then the fossil fuel industry wins, for, in this example. So part of what you do is, is kind of building momentum, bringing evidence, being this kind of person who cares about health, who cares about, the status of health and other people and the betterment of kind of everyone in society over things like commercial interests or polluting sort of modes, I'll say modes. So yeah, a lot of it's that kind of lobbying where you're actually directly meeting people and directly trying to get them to focus on health. And yeah, organizing meetings, writing position papers, bringing together evidence, contributing to joint statements, that sort of thing. That's how I would run my job day to day.
Thank you. We do have one more question, but I think we are running out of time, unfortunately. So thank you, Sohaib, for your question. We'll just take note of it and hopefully get to address it somehow in another event or somehow. But I think now we're going to wrap up. Thank you very much, Cale, and everyone who has participated and been present in the organization of this event. I hope it has been insightful. I hope some of your questions have been answered and that you have a clearer idea of what you can do in global health and policy. Yes, I wish you all a very good rest of your day and see you in the next one, hopefully. Bye-bye.
Thanks, everyone.
Thank you. Bye-bye.
Thank
Bye.
you. Bye.
Bye.